Hello, GFPD families. My name is Abby Pelster, and I am the Community Engagement Manager for the GFPD. And today we are going to share a webinar on the financial impact of rare diseases, with looking at rare diseases as a whole and also sharing data and information specifically for our GFPD community. Next slide. So the mission for the Global Foundation for Peroxisomal Disorders is to improve the lives of individuals with peroxisomal disorders by funding research, championing scientific collaboration, and empowering families and professionals through educational programs and support services. Our values spell out the acronym CHAMPIONS, and we keep this at the forefront of all of the work that we do. So community, hope, advocate, make a difference, persevere, inclusion, our families, navigate, and scientific and medical research. And finally, we know that peroxisomal disorders impact individuals of every race, ethnicity, socioeconomic status, sex, gender, sexual orientation, belief system, ability, and age. So using our GFPD values of inclusion and community as our guide, the GFPD is committed to promoting acceptance and advocating for equality and equity in healthcare and educational settings while combating prejudices, discrimination, and biases. We will engage in this important dialogue with our diverse community by listening and learning from our families, researchers, and professionals. So today we are excited to share some information on the financial impact of rare disease with research that has been completed by Global Genes, as well as data that we have collected from our GFPD families. And so Dan Billingsley, our strategic scientific advisor, one of our strategic scientific advisors for the GFPD, and many of you may have met him at the conference this past summer, is going to go through this data with us today.
Thank you so much, Abby. Again, we want to give a big thanks of gratitude to Global Genes. As many of you know, Global Genes has long time been a supporter of the work of the Global Foundation for Peroxisomal Disorders and many other rare genetic diseases. Recently, they have completed a large-scale landscape assessment around financial advocacy, particularly hardship, for those who are affected by rare diseases. And we thought it would be great to share some of this information with you, along with some research that we have done with our families, and to talk about some future research as well as resources available to all of our families and caregivers. So a little bit about the study. This was the largest study on this topic to date and was championed by Global Genes. It is specific to those individuals who are affected by rare diseases. As we know, rare diseases affect more than 30 million people in the United States and 1 in 10 around the world. The GFPD recently received a grant to support further data research. And today's data comes from the landscape study, along with a short survey that we provided to conference participants following the event in June. A bit about the methodology of this study. The study period was between 2010 and 2020, with most of the information coming pre-pandemic. It began with PubMed searches using various keywords. And the keywords that they used are to the right of the screen. Those include things like economic burden, financial hardship, health policy, quality of life, and socioeconomic burden, among others. Global Genes also used a great bit of their own existing data to form the more than 50-page report. They also included digital listening sessions with a number of folks that were affected by rare diseases, and they used other qualitative data available to them, such as medical data and other information. There were several interviews done with patient advocates, particularly those who had been navigating the medical system for the last 10 years. So a few of the key findings that we wanted to talk a little bit about today. One of the factors that they were looking for was indirect cost, particularly to families and caregivers of persons diagnosed with rare diseases. These direct costs tended to be medical costs, but also involved much around the diagnosis and the process of getting treatment for individuals with rare diseases. One of the chief factors in costs was the lag in timing for diagnosis. Many of the individuals who were diagnosed with a rare disease had to go through months, if not years, of diagnostic process. Another factor in the cost included research for information, both for the medical professionals and the patients and caregivers. Other delays in the diagnosis included assessments or treatments and extensive diagnostic journeys that ended up with very large medical bills. There were a number of challenges with insurance reimbursements, approvals, frequent hospitalizations and emergency room visits or doctor visits, the travel and time for caregiving and disease management, and frequent challenges to other determinants of health, such as education, healthcare access, mental health, etc. These were the direct costs that the Global Gene Study talked about most. As many of us know, those affected with peroxisomal disorders also report some of these exact same findings. We just now have the data from the research project from Global Genes to back up what we've been hearing from our families for the past 12 years since the GFPD was founded. So a little bit about the impact, especially the longer term factors in the cost. One of the issues has been in high cost in treatment. As many of us know, the rare disease community typically has smaller access to pharmaceuticals. And when we do have access to those pharmaceuticals, they can be incredibly expensive and sometimes out of reach for some of our patients and their families or for the insurance companies covering them. The other issue is that many of the rare diseases are incurable chronic diseases or debilitating disorders, which lead to long-term cost factors. The access to caregiving was also a major issue pointed out in the landscape study. Also, access to education, healthcare, and economic stability issues for families was another problem that was noted several times within the study. There's also a high disability rate versus the disability rate of the general population with people affected by rare diseases. This in turn creates a lot of lack of economic stability for our caregivers or even access to health insurance and long-term benefits for those affected. One of the other issues that the landscape study pointed out was a lower financial literacy or access to family planning for many of the patients and their families. The other major issue was high out-of-pocket spending, leading to other financial crises that include food insecurity, inadequate safe housing, and more. One of the major pieces of data that we pulled out of this study is that nearly 3/4 of people affected by rare disease consider the cost to be high and difficult to manage. So why does this matter, especially around the cost burden? The direct medical costs, along with the toll of indirect costs, loss of wages, and out-of-pocket costs, have created the financial hardship that is very common among those with rare diseases and their caregivers. So some of the major conditions that we see, again, are out-of-pocket medical costs, indirect costs, medical debt, but this can lead to asset depletion and even bankruptcy, particularly in the United States. This also causes a distress in psychological response, including wage concerns for those who are taking care of their loved ones with a rare disease. We've also noted other coping behaviors that affect not only those with rare disease, but the caregivers themselves, such as non-adherence to treatment or delay for normal or even chronic illnesses, skipping or reducing medication doses, avoiding filling prescriptions, or reducing spending on other healthcare needs. So those are some of the highlights of the landscape study. We decided to do a bit of surveying of some of our GFPD families who had been to the conference in June. And for those of you who attended, we really appreciate your feedback that we got about the conference. So 28% of the families that attended that conference completed a survey, and this survey addressed everything from satisfaction and usage to also some of the behaviors and some of the learning opportunities that we had at the conference. We also asked them several questions around financial hardships for their warrior in the rare disease. So one of the things we pulled was a bit of demographic data. And interestingly, 8 out of 10 of those respondents indicated their household income of more than $75,000. The income brackets were specifically designed to mimic those of the federal poverty level, and then 20%, 50%, and 100% above the federal poverty level. The majority of our responders had some college education or higher, were homeowners, and had 3 or more people living within the household. Now on to the financial impact. Nearly 80% of our conference attendees requested and or received a stipend to attend. Those stipends were made available by generous donors and the board of directors for the GFPD. 7 of 10 of the responders stated that the stipend was a decision factor in their attendance in coming to the conference. And the majority of those who responded said they would not have been able to attend if it weren't for the stipends available for the conference. Several people indicated that there is further information needed to help them navigate the world of rare disease and treatment for their warriors with peroxisomal disorders. Some of those information needs were insurance and navigating the insurance system, new therapies that are available, particularly medical interventions that can be put into place directly without any extra scientific research. Equipment was also a major concern, and as many of you know who have attended a conference, we have a very robust equipment exchange among our families. But one other interesting note is that a number of families need more information around end-of-life care, particularly palliative care, hospice care, etc. 15% of respondents stated that medical costs were outside of their budgets, creating hardships for them. However, 3/4 did say that they use a monthly or annual budget. However, 90% do not have access or do not use a financial professional in their planning. So those were some of the pieces of information that we pulled out of our own data available to us from our families. But I did want to note several bright spots that came out. The first and foremost were the GFPD stipends. The GFPD has made a real push and priority to ensure that every family can attend the conference without major hardship. So those stipends for families were made available through contributions from our donors, Global Genes and their support, as well as support from the Chan Zuckerberg Initiative. And as I said prior, this was a priority of the board of directors for 2022. Another major bright spot was the inclusion of scientific and clinical attendees. More than 50 scientists, physicians, and other clinicians attended the conference. This turned out as a donation of hundreds of hours of clinical advice and assistance. Many of you may have participated in the professional pop-ins with people like Abby and other speech pathologists or physical or occupational therapists. Many of you visited with physicians and scientists, and your children got to see some of those folks. We estimate that the value of that scientific and clinical assistance may have been more than $125,000, and that is all donated in kind from those professionals. Another major bright spot is the Warrior Camp. As many of you know, and Abby, who is on this webinar, our Warrior Camp is able to provide a really stimulating, great experience for all of our kids, whether they're affected or not by peroxisomal disorders. We have a system of fellows, and there were more than 24, mostly through a partnership with the University of Nebraska and others, who donated more than 3,000 hours of total time to provide this amazing experience for our families. We estimate that the financial impact of that alone was more than $100,000 of donated time. So a few next steps, and this is where we need you. We need more data. As you know, the GFPD is very committed to research, but part of that research is really understanding our families. And our families is the word of the year, our value that we're focusing on in 2022. Many of you have received a number of emails and communications around various surveys and future focus groups that we'll be using. We want you to know that those questionnaires and surveys will be used to help us shape and mold programming for the future. The interviews and focus groups that will be happening are going to be around some of these issues for financial hardship, our programming, diversity, etc. So please keep an eye out for how you can participate in the future. And then the final next step is that we plan to prepare more resources along with this study so that we can get our families and our caregivers as many resources as possible and prioritize the availability to you so that you have them, at the tip of your fingers. So I'd like to turn it back over to Abby right now, who's going to talk about a few of those important resources that you can access now and in the future.
Thanks, Dan. Global Genes has put out 3 different resources in addition to all of the great information Dan just shared from the landscape study. The first tool from Global Genes is Navigating Health Insurance. Now, this is a document that was published in 2016, and we're proud to say that a member of our GFPD community was actually a collaborator on this document. And so we all know that health insurance is big and confusing and frequently changing. And so this toolkit can help you navigate health insurance with the rare disease perspective in mind. So it's specifically made for the rare disease community. Rare Insights, Building a Stronger Financial Future, is a great tool that includes many questions to kind of get us thinking about, oh, have we thought about this with regards to financial planning for our family? And so a lot of thought-provoking questions. They also have a great overview of terms and suggestions for moving forward for financial planning, which could include consideration of some kind of individual financial planner for your family. And finally, a third resource is Financial Advocacy in Rare and Navigating the U.S. Health System for Young Adults. So as our warriors are getting older and transitioning into adulthood, that has a whole different meaning in health insurance and finding those resources. And so this is a tool to support those families. In addition, these are 3 resources for you, but there are lists of resources at the end of every single one of these documents. And so hopefully they can help our families. And like Dan said, we would love continued participation in completing our survey so we can continue to find and create resources that specifically address the needs of our GFPD community. So part of our mission statement is, of course, to provide support to our families. And so financial support and information is a huge piece of that. And so please reach out to us if you need some help. We would be happy to get you some resources, connect you with someone. Health insurance, one thing that's so challenging is it varies so much from state to state, but we will do everything we can to support you. So we're here to help, and you can reach us at contact@thegfpd.org. So thank you so much for watching our webinar today. We hope that this gave you some good information about the financial impact on the rare disease community as well as our GFPD community. And we hope to continue to provide you with more resources in the future.